Hello viewers, today I'm going to demonstrate you a injection technique for a clinical condition called trochanteric bursitis. Trochanteric bursitis is a common cause of pain on the side of the hip, and if you have pain on the side of the hip which gets worse on lying on that side, then it could be trochanteric bursitis. Today's video is about demonstrating how to inject trochanteric bursa in a safe way. So you can do it in this injection in two positions, either supine or lateral, and I would suggest lateral is better because in obese patient the fat falls on the sides and it gives you better access. So I'm drawing this trochanter. This is the front part of the trochanter, this is the back of the trochanter, this is the tip of the trochanter. So this is our area of interest. Now the second thing is to identify which is the most painful area, and I've already examined him. This is the painful spot for him. So I'm going to inject through this area and then I will show you what I inject. So my mixture for injecting trochanteric bursa is around 8 mils of 1 or 2% plain lignocaine, and I take 80 milligram of depomedrone. So the total mixture comes to around 10 mils. Now in terms of needle, if you have a thin patient, I think green needle will suffice. However, if you are injecting a patient which is quite obese, then you may have to use some form of longer needle, usually a spinal needle, to reach to the area of right spot and to inject. So once you are happy and you have identified the painful spot, you just go vertically and then aspirate. There is not much important vessel, so just go gradually, slowly. It can be quite discomforting, so just go slow, give it some time for local anesthetic to act, and then just gentle little bit more. And as the local anesthetic will act, the pain will go away. Just keep injecting the painful spot. And you need volume because you want it to spread, because it's very hard to localize the exact area. So you can see there is a bleb which has formed. So what I will do is I will take this off and will gently rub it for it to act. And now you see, if I am pressing it, previously this was a painful area, but it won't be hurting him as much. And end of it, all you need is some form of sterile dressing to go on top of it, and that is how you inject a trochanteric bursa. So viewers, this was a demonstration on how to inject a trochanteric bursa. Now my key message is try to do it in a lateral position, because even in an obese patient the fat falls away and it is much easier to palpate the greater trochanter. The second message is to use enough volume, so I will use at least 10 ml of a mixture of local anesthetic and steroid, and also if necessary in an obese patient you should be using a longer needle, because you will feel the needle hitting the GT. Until unless you have felt that, it's very difficult to be sure that you are in the right spot. And also palpate the right area of most painful spot and inject that area. I hope this video will help you in your clinical practice while injecting a patient with trochanteric bursitis. If you like this video, please give us a thumbs up, please do subscribe and do share our channel. Thank you.